With the LRA testing, we're obviously supporting many conditions and the immune system. After removing the offending items and following the detox and GI protocols, are they sufficient, or are there additional protocols you recommend to support the rebuilding of the immune status for chronic conditions, chronic immune conditions?
A very important question. So many people today have autoimmune self-attacking conditions, which means there's an impairment in the way the immune system is functioning, or they have inflammatory repair deficient conditions, or they have other degenerative conditions. These used to be fairly rare. It used to be rare to have heart attacks and cancer. It used to be rare for people to die of things other than natural causes if they lived past childhood. So we have really improved maternal and fetal health, but we have barely budged adult health because we've been at war with the signs and symptoms of ill health, and we really have forgotten about evoking human healing responses and removing obstacles to recovery, which to me is a better value proposition. It's less risky. In my experience, if it's done coherently, it's more effective. And now the question you raise. With our LRA tests and health appraisal questionnaire, we can guide the individual to the initial program to restore their health. After 2, 4, 6 weeks on the full program, because it is about what you eat, drink, think, and do. So you want to have the foods you can digest, assimilate, and eliminate without immune burden. That's where the testing comes in. You want to have a lifestyle program. That's where the health appraisal questionnaire blends with the cell cultures to give us that ability for us to interpret the results and put the forward health plan in place. I would like to point out that we are far upstream from the condition, the symptom that emerges. And that's the strength of what we're doing. We're looking fundamentally at the immune defense and repair system. We're looking to make sure that there are no hidden sources of immune burden. We're looking to comprehensively reset and restore immune defense and repair function. That takes months. It often takes several 6-month cycles, depending on how far along people are. It is the first line of really comprehensive therapy today. And no, it's not specific for diabetes or for arthritis, because they're both autoimmune. It is applicable to all autoimmune, to all inflammatory, to all chronic, to all persisting conditions. And the mind and body are always connected. So we need to attend to how we move and how we think. We can worry ourselves sick. We could be in denial about what's going on. Or we could look at ourselves in the mirror and say, you know, I want to live. In fact, I want to live enough that I'm going to make little changes in daily habits and see how well I do, because I'm going to be assessing myself. Up until our approach, those advocates for biochemical individuality or for personalized medicine, they weren't able to look at the 8 predictive biomarker tests for further guidance and further refinement of individual needs. So we start with the LRA test, but I would like to know what the hemoglobin A1C is, and I want it to be less than 5%, and many people have metabolic syndrome, insulin resistance, etc. And then I do want to know whether there's a repair deficit and an increase in the high sensitivity C-reactive protein above 0.5. And I do want to know if the homocysteine is above 6. And I do want to know if the urine pH after rest is between 6.5 and 7.5. And I do want to know if the vitamin D level is between 50 and 80. And how much vitamin D do people take? As much as they need, preferably drops under the tongue before swallowing, to get consistent uptake and go to the brain first before the body, because vitamin D is a neurohormone. And then we have 2 more. We have the omega-3 index, which should be greater than 8%. And we have the 8-oxoguanine, the measure of oxidative damage in the nucleus and the DNA. and that should be less than 5 nanograms per milligram creatinine. So we know what the full suite of tests, there's only 8 that you need to cover epigenetics and lifestyle. Now, many people will start with the LRA test and plan, apply it for 6 months, and then come back and see if there's anything left that needs to be further improved upon. Other people will start with all 8 predictive biomarkers and have an even more comprehensive, fully epigenetic approach, rather than one that starts with immune defense and repair and sees what else might be needed, if anything.